Hey there, Darius. Thanks for joining us today.
Hey, Queen Bee.
We always enjoy hearing from you. Remind us again why HIV is such a prevalent issue in 2022 for Pinellas County.
So, Pinellas County has seen disproportionate cases of HIV acquisition within the last several years, particularly with our young Black men in the 20 to 29-year-old age group. Also, we've seen with Black women, um, there's an inequity in terms of the number of cases versus women, let's say, per se, of other races. Pinellas County was one of 7 counties in Florida that have been identified in the Ending the HIV Epidemic, or what we call EHE for short.
Okay, so Darius, the Pinellas Ending the HIV Epidemic initiative is all about working in partnership with the community. Who are some of those awardees and initiatives that have been undertaken?
So, Queen, some of our current community partners that we're working with on this initiative are Metro Inclusive Health, Impact Partners in Care, that's EPIC, Banyan Tree Project Incorporated, Help Us Help You, the Minority Alliance for Advocating Community Awareness and Action Incorporated, which is MACA, and the University of South Florida's Pediatric Infectious Disease Program. So the current initiatives that we're working on include focus groups that identify barriers to treatment for people living with HIV, street teams, foot teams that promote HIV prevention, messaging around HIV education prevention, social media marketing campaigns for HIV testing, stigma reduction, also youth education and training services.
So, what is the goal of these initiatives for the community?
So the goal of these initiatives has always been we want to reduce the number of HIV cases in Pinellas County. We want to educate and empower our communities to make healthier decisions regarding their sexual health.
Okay. Now, Darius, World AIDS Day was December 1st. What is the significance of this awareness day, and how does it influence the work that Pinellas EHE is doing?
Thank you, Queen. So December 1st is World AIDS Day, and that's a global day of recognition that um, reminds the world that we have to unite and come together to end HIV. Pinellas EHE began its work on this initiative several years ago, and we currently have a 12 days of EHE media campaign that started every day, where we will daily highlight some aspect of this initiative, our mission statement, for example, projects, advocates, or leaders in our community who are working to help us in this initiative.
Okay, and Darius, is there anything else you would like to say?
So I want to talk just a little bit about the ending the HIV epidemic, just to refresh the minds of the listeners. The goals, there are 4 pillars to the ending the HIV epidemic, and those are diagnose, treat, prevent, and respond. Diagnosing all people with HIV as soon as possible, providing treatment for those people, getting them into care rapidly and effectively. We want anyone with an HIV diagnosis to be virally suppressed, meaning that they can't pass the virus on to other people. We want to prevent, of course, new cases of transmission when we can through proven interventions like PrEP, for example, and our syringe needle exchange programs. And of course, we want to respond quickly to any new outbreaks of HIV in our community. We want to provide treatment, prevention and treatment services to people that need them. Our goal with this project has always been that we want to decrease new cases of HIV in Pinellas County. We want to see a change throughout our county. In the past, we've identified some of what we call our high-risk zip codes, which are 33701, 33705, 33711, 33712, and 33713. We know, of course, that we do have cases all across the county, but we have zoned in kind of on those specific zip codes. And so we want to continue to partner with the community to be the change that we want to see. And as I've always said, change is never easy, but it's necessary. And I also want to encourage everyone to go to our website, www.pinellasEHE.org, for more information.
Indeed. That's www.pinellas.org. Darius, you're the best.
After you, Queen. I'll take second best.